to general psychiatry nursing management. Within this lesson, we are going to simplify ways in which you can nurse a patient with a mental illness. Of course, we are looking at the nursing care that can be provided. Okay, so we have come up with a mnemonic which is mental patients. This mental patient gives us the framework on how you can nurse a patient with the mental illness. Of course, I have come up with other mnemonics on how best you can nurse a patient with mental illness, like the Chebo Ara. Okay, I urge you to look at that lesson where we talk about Chebo Ara. Okay, so Chebo Ara stands for counseling. Each and every patient with mental illness needs counseling. So counseling can be at individual level. So the person with a mental illness may need direct counseling as an individual. Then we have counseling at family level. It's quite stressful to nurse someone with mental illness because the condition tends to be there for a long time. So family needs to be counseled on the disease process. Then for mental health condition, we also need community counseling. This is to avoid stigma and discrimination that comes from the community and also prevent mental health conditions within the community. So that is to do with C, counseling in table. Okay, then H is for hygiene. Okay, so hygiene in nursing care has to do with oral care, hair care, and bathing of the patient. Any other items that you do in nursing care that promote hygiene can be promoted under H in table R. Okay, E is for environment. And what is cardinal about environment is that the environment needs to be safe both for the client and also the people that are around. So the environment needs to be safe for the client, people that are helping to care for the patient. Okay, so that is in the table. E is for environment. Then B is for behavior modification. Behavior modification, here I would just want to refer to one psychology model where you learned about um, reinforcement. So there is positive reinforcement, there is negative reinforcement that can be applied in order to modify the behavior of a patient with the mental illness. Okay, so that's the behavior modification. So under behavior modification, um, in my proposed model for the framework of nursing, we talk about the train. Okay, so that we try to give it shape on a lot of things that you can talk about. So in the train, we learn about T, talk about it. Okay, it is more like stress management. So when you modify one's behavior, then you are also managing those stressors that are precipitating an attack. So T is talking about it, which is communication therapy. And communication therapy is a skill that a mental health nurse needs, okay, in order to help manipulate the environment of a patient with mental illness so that they can recover. So T is talk about it or use communication therapy. R is rest. Okay, rest is important. That is, sleep and rest is very important to help improve mental function or to help your brain to relax. You know, a lot of work is going to cause a lot of stress within your body. When that stress reaches alarming levels, then it may turn to be to manifest as a mental illness. So that is why in the train we have rest. So rest is very important for for the for a healthy mind. Okay, so that you can function very well. Then we have activity. That is in the train we have A. So A is for activity. It is important to draw up an activity plan, or it's important to come up with a discharge plan. This will help you to see what activities the patient that is doing, which socially may be looked at to be abnormal. Then, as a nurse, you are going to work towards eliminating these unhealthy social behaviors. Okay, so you develop an activity plan that can help the patient recover from this. So, the activity plan A, necessarily, we are looking at the discharge plan. Okay, you're looking at the discharge plan, we are looking at the admission of the patient with mental illness. So the admission process should be taken care of in a way such that if the let's say patient was a parasuicidal patient, the patient should not come and finish their mission of trying to commit suicide within the ward. So what do? You have to remove patient's belt, you have to remove patient's shoelaces, you have to ensure that there are no naked cables within the patient's environment. The issue of isolation can still come in. So when you're talking about AA activities here, these surrounds admission, okay, admission activities and the discharge planning activities. Okay, so in the train, we also have I interest. So I interest is for interest groups or networking with interest groups. Okay, too much of one thing also brings stress to the body. So developing interest in the environment and the people around you, the support groups. Okay, so that is the interest support that the family needs. Interest, the support that the community needs. So you need to draw interest in the organizations that are there to help out with the patients that may have these conditions. Okay, then N is for nutrition. Nutrition in mental health, we talk about fingering foods. Okay, fingering foods, that is food that the patient can eat whilst he's standing, okay, or whilst walking about. So we encourage fingering foods. So behavior modification is about reinforcement, positive or negative, and then you can talk about train because it's a train that is T for talking about it, like I have explained, can help you have a very good framework on how to nurse a patient with mental illness. Okay, O is observation. Okay, so when I'm talking about observation, I'm looking not only at temperature, pulse, and respiration. Okay, in the we are looking at another framework that I've drawn or that I've proposed that is quite helpful for mental health observation. So you're going to do the temperature, pulse, respiration, those that are supposed to be done. You're going to do them. But there's the coast map. Okay, the coast map, that is when you are observing, you look at the level of consciousness of the patient. So that is the C in the coast map. Okay, then O is look at the level of orientation. Okay, A, look at the affect. Is it appropriate? S, look at the patient's stimulation. Okay, stimulation or their sensation response to things that are happening within them. Then T looks at the thought process. Okay, so what manifests within the brain, okay, or within the thought process is seen in the patient or can manifest in the patient's physical well-being. So T is for thought process. Then it's cost map. M is for memory. Okay, so patients with mental illness may have some problems with memory or returning memory or knowing necessarily where they are. So that is the aim. A is anxiety. Okay, when a client is anxious, they may do certain things, not necessarily because of mental illness, but because of heightened levels of anxiety. Then P is perception. When you are observing the patient, look out for the things that may be disorders of perception, that is illusions, hallucinations. Okay, then in the thought process there, you can also rule out disorders of thinking like delusions. So it's important that when you're observing a patient with mental illness, you look at cost map apart from the temperature, pulse, respiration, and blood pressure. Okay, so now that since it's Chebo R is for rehabilitation. All patients with mental illness needs skill rehabilitation, need survival skill rehabilitation, and all that. So now here we are using mental patient. Mental patients again as a framework for the general care of patients with the mental illness. Okay, so what do the letters in mental patients and patient? It can be written in full as patient, or you can use PTS, okay, to denote patient. Okay, so within the mental patient, here we are saying M patient needs medication. Okay, so aim is for medication within the framework. The medication that is supposed to be given for that particular condition is very, very important in order for you to promote recovery of the patient with the mental illness. So aim is for medication. Please, you also need to note that M is not just standing in for medication. There are also other things that it can stand in, like mirror therapy, okay, which is a safe, structured group treatment in which you nurse a patient in a conditioned environment and help them to achieve certain activities, activities of daily living. So you can have mirror therapy. So mirror therapy is a very good treatment, okay, that can also be used for the letter M in a mental patient. Okay, then we have other letters that we have tried to use letter M to say this is what necessarily it implies. M may imply modifying behavior. M may imply modifying the patient's environment. Okay, so a little bit of modification of the patient's environment, like with depression, with mania, or suicide, can help the patient to recover. So M can also be used for modification. Okay, M can also be used for medical education or mental health education. Okay, so M can also be used for that. Okay, then maybe other letters you can still propose okay, within this model and enrich this model that I'm trying to propose when you are nursing a patient with the mental health. So we have to move on. Okay, so moving on, we are still looking at the new model, okay, that we are trying to propose here on how best you can nurse a patient with mental illness. Okay, so Chevo still stands as one of the best models that you can use. Chevo R still stands as the best model that you can make your writing or your caring for patient with mental illness, to be so easy like drinking water. Okay, so this one is to help you associate it with mental health. When a mnemonic is complicated, it becomes very difficult to remember it. Okay, so for Chevo, I looked at it as more of a Bemba word. Okay, okay, as a Bemba word that can help us to remember. But now, the discipline we are looking at right now is mental health nursing. So we have to relate it to mental health nursing. That is the mnemonic. So that is why we have mental patients. The shorthand for writing patient is P, that is capital letter P with a small letter T. Then S to say plural patients. Okay, so in the table R mnemonic, I've explained what necessarily the letters stands for and how it looks small, but it's quite big. When you are talking of it, it's not just about counseling. For C, hygiene. For H, then E is for environment, like B, behavior modification, which brings about uh, positive and negative reinforcement for you to achieve extinction of undesired behavior. Of course, this has been drawn from some psychology theory that looks at how behavior can become extinct. Okay, then within the behavior model, we looked at the train, the talking about it, the rest. Okay, rest is important to improve your immunity, rest is important to improve your mental functioning. Then A, we say that is R for rest. Then A is for activity. Okay, activity that is to do with admission, activity surrounding discharge. Then I, we said interests, that is to do with group interest. Okay, I can also signify isolation. Okay, I can also talk of investigations that can be done within mental health. Okay, so those things are very, very important as you are nursing a patient with the mental health. Then N, we said is nutrition. Okay, there are some foods that can help in the repair of worn out brain tissues. So those foods that are very good for the brain, you can encourage. But apart from that, we talk about ketogenic diets. Okay, for people with epilepsy. Okay, having a ketogenic diet can help reduce epilepsy episodes that one tends to have. Okay, so there's a lot that you can still research more on that, but our main aim here is to give you the framework and then you study more about the framework so that you improve it. Then, that's where we have the cost map, and I've explained what is within the cost map there. Okay, it's important that the usual way of routine observation that we have in mental health to do with temperature, pulse, respiration, and BP observation, there is the cost map, which is very, very specific to nursing a patient with the mental health. Okay, then within this discussion, though I've tried to simplify it so that the video is not too long, we are looking at the mental patients. Okay, so in a mental patient, we have M for medication, but M also represents other um, other elements that can help us in nursing a patient with the mental health. So it also represents mental health education. It also represents modifying of behavior of the patient. It also denotes real therapy. It denotes also the medication that I've tried to put here across so that you can refer to it. So this is the mental patient. Okay, this is the mental patient that I have put here. So it's important that you know all this. Okay, so once you know all this, it is going to help. Okay, so that is the aim. So the mental patients here. Okay, so now within the mental patient here, we have E, which is symbolizing environment. Okay, so E, you look at the safety of the environment. Then from safety of the environment, that is mental, ME, then N is for nutrition. Okay, remember we have talked about fingering foods and nutrition. We have talked about food that patient can easily eat whilst they are moving up. Okay, so all these things you can see that we have tried to borrow from table R. Okay, where these items were still applying. Okay, then T is for therapeutic relation. Okay, so the therapeutic relationship is very important. So the nurse needs to establish a rapport with the patient as they are nursing them because this will promote cooperation. Nurse needs to establish a rapport with the patient's relative, okay, as this will help in the improvement of the patient. Then A is admission, okay. The admission process needs to be followed well for patients with mental illness because it will help us to understand whether the activities that we're able to do at admission and those that are able to do at discharge, if there's improvement. So admission, that is A, we talk about admission. Then L is lookout. So the lookout here is for observation. So this is for observation here. Okay, then observation here we are using coast map. Okay, so the observation we're using coast map, that is the coast map here. Okay, so this coast map is trying to educate us that we do not just look at temperature, pulse, and respiration. Then P is for psychological care. Okay, even patients with mental illness needs this psychological care because there are different types of mental illnesses. Okay, so there's depression and there are also all those other conditions. So psychological care is important. Can be directed to the patient, can be directed to the relatives. Okay, so most important point here is necessarily what content you have to put in psychological care. Then T in the patient, okay, is talking therapy. Okay, so talking therapy, which is communication therapy, is very, very, very important. Okay, communication in management, we look at it as exchange of information between two parties. But if you are to look at communication as therapy, we are looking at how you interact with the environment as an individual, how you interact with an environment. So, using communication as therapy is very important in promoting patients' recovery. Then S is for social skills. So this is the social skills here. Okay, so that is S for patients. So social skills, okay, once you have admitted the patient, you need to assess that the patient is improving on their social skills. So it's very, very important as you are trying to have the patient recover. Okay, so on this other side here, I've tried to put in what these terminologies can necessarily mean. Okay, here I might talk about social skills, but S can also mean other things that you can help the patient to improve on. So here on this part here, you see that I've tried to modify, not just to talk. This letter is standing in for this. Okay, so here N necessarily was standing in for nutrition, then T was standing in for therapeutic relationship, then A was for admission planning. A can also mean training patient on that is to do with assertiveness, so assertive skills or teaching patient assertive skills. Then A also can represent drawing up an activity plan of activities of daily living that a patient should do in order for you to see that actually they are recovering and they can be discharged. So then on the lookout, I still have observation and the course map. Then for P, I have preparation for discharge. And then P, I have psychological care, which I've tried to put out there within that mental health. Then problem solving skills are also very important to be taught to the patient. So for P, I've also indicated that it can be for problem solving. Then P can also be for psychosocial rehabilitation or necessarily rehabilitation, but we want it to fit in our mental patient mnemonic. Okay, then T is talking therapy, okay, the patient, so that is communication, okay, therapy. Then S, okay, that is patients. The S there is for social skills. Then also for survival skills. Then S is for self-awareness. S is also for somatic therapies, and also S can be for stress management skills. Okay, so that is how we have tried to expand. Okay, that is how we have tried to expand on this part here. Okay, so that within this mental health, you can have a lot of elements that you can use. So here we have expanded that. Okay, so now on this mnemonic, we are just going to discuss some few or just sample some few elements here on how best you can nurse a patient with the mental illness. Okay, so here we have mental patients, and then we have these mnemonics. So these are some areas that we are going to sample. Okay, that we are going to sample within this discussion. We're going to sample these on how you can nurse a patient with the mental illness. So moving on, okay, moving on. So when you have admission, you have to welcome the patient and introduce the patient to other patients within the ward, because this will help them to feel welcome. So introduction of the patient, or patient introduction to others as you are bringing them, it will make them feel welcome. You have to admit the patient in a closed ward. This is to prevent the patient from escaping. The risk of the patient escaping with mental illness is quite high, because most of them do not believe actually that they are sick. Actually, they will say, these people who are bringing me are the ones that are sick. Okay, so the environment that the patient you have brought them in is quite new. So orientation of the patient to the ward is also very important, so that they can be familiar, and it will also reduce anxiety that the patient may have because of lack of familiarity with the place. Okay, then um, the other things are to do with the safety of the environment. You need to label the things that are within the word for easy identification. Okay, that is to do safety of the environment. So you have to label the things that are being used within the word. You have to remove sharp objects. This is to prevent harm to the patient and also harm to others. You have to ensure that the doors closing from outside. This is for quick intervention in case of suicidal attempts. You have to remove the shoelaces on the patient. Of course, this, when we're discussing about TOR, I've mentioned this is to prevent a suicidal attempt, as the shoelace can be used for patients to succeed with their suicidal ideation or suicidal attempt. You have to maintain a quiet environment for the patient. This is to promote rest, and also restrict visitors to allow the patients to rest. Okay, and as you restrict visitors, it will also help the patient, okay, to work towards those things that you have put within the activity plan for patient to accomplish. Always have significant staffs available in the wards. This is for provision of manpower in case the patient goes out of hand. Okay, patients with mental illness sometimes do go out of hand. Okay, then the other elements to do with safety of the environment should be good enough to provide good air circulation, and should not admit patient, or don't build a psychiatry unit that has got upstairs, because patients can easily jump from the building and become successful with their suicidal attempts. Okay, so it is also important to remove electrical appliances in the wards, because patients can use these in their attempt to commit suicide. It can even be this patient also. When you are nursing patients in psychiatry units, also ensure that there are no flammable objects, okay, such as fuel, candles. This is to prevent harm coming to the patients, or prevent accidents within the ward. So ensure that there are no flammable objects. Okay, then we can move on and look at psychotherapy. Okay, psycho from psychology, so psychotherapy. Okay, talking about psychotherapy here, you have to explain to the relatives why the patient is behaving in such a way, so that they have an understanding of the disease process. Okay, you have to create a very good rapport with the patient to promote cooperation. Okay, that is between the patient and the nurse. And you also need to be calm in everything that you do so that the patient is confident in what you're trying to do to help them recover. You have to ensure that you reward the patient for any positive behavior so that they feel respected, and this is going to help in promoting healing. Okay, for patients that may be having hallucinations, you can explain what hallucinations and delusions are. Okay, this will help prevent the patient from becoming suspicious. Okay, and start thinking that you are talking about them. Okay, and to promote positive behavior, you have to ignore whatever nonsense, okay, that the patient might do. This is to help augment appropriate behavior. So anything, okay, that is not in line with the prescribed social behavior, okay, which is termed as nonsense, should be avoided. Okay, should be avoided as you are taking care of the patient. Okay, then other elements in the psychotherapy is that you have to encourage relatives to show love and support so that the patient can feel that they are cared for. You have to reassure the relatives that the healthcare team is doing everything possible to manage the condition. Okay, so once you promote this confidence, it becomes very easy also for the relatives to cooperate. Okay, then looking at another element here to do with nursing care with patients with mental illness, we can look at nutrition. So you have to give a type of food that is hand food. Here we have mentioned that you can give fingering food. You can get the food from whichever place you are serving the patient and put it maybe in a plate where you can put everything for patients to necessarily access the radish and the shima and all the other things that they can and be able to eat whilst they are moving about. Allow the patient to eat with others, as this also promotes socialization and improves socialization of the patient. So patient can eat with others or in an environment where others are also eating. Apart from this, we can talk about protein to repair our tissue, fiber diet to prevent constipation, giving of fluid to prevent dehydration, of which maybe patient might not be even at risk of dehydration, looking at the presentation of most mental illnesses. But this is very, very important or cardinal in the patient's life, despite having mental illness. Okay, then we can look at therapeutic relationship. Okay, the term therapy just means providing or giving remedy. So therapeutic relationship here we are looking at nurse-patient relationship, which should be healthy, so that the patient can cooperate. So you have to show non-judgmental behavior to the patient so that you gain trust, and you have to pay attention to the things that the patient is verbalizing. Okay, it will help you to bond well with the patient and develop some trust. It is also important that you can be making some small promises to the patient, and also that you fulfill these promises that you make to the patient. Okay, so these promises you make to the patient will help the patient to know that the patient is trusted, and also that you can also be trusted. So it will help you to bargain with the patient when you make such promises to say, okay, if you're able to do this, this is what I'll give you. So patient will do that normal thing that is they're supposed to do, then you reward that. Okay, you can spend some time with the patient's relative so that you can also help the relatives to gain hope that the patient is recovering. Okay, and then you can call the patient by the name. That will all help to show that you respect the patient. Okay, so human being will not just be want to be addressed as a thing. So calling someone by their identity is very, very important. Okay, when you take vital signs, explain how the vital signs are to the patient because it will help them to know the progress that they are making or progress that you are making as you are caring for them. Okay, then the other elements that we can look at within relationship is that you can use a firm and calm approach when communicating with the patient. This is to provide structure and control for the patient who might be out of control. You can use a short but clear explanation. Okay, this is avoiding to be complex. When you're complex, the patient fails to understand what you are saying. In other words, if you try to be complex, you might just find yourself that you are just communicating to yourself. Okay, then we can move on to behavior modification. Okay, behavior modification, this is use of basic learning techniques such as the reinforcement. Okay, this reinforcement, you learned it under some theory in psychology. So you can reward the patient for positive behavior, praise them, or give what we call positive reinforcement. Then negative reinforcement, that is to correct the socially prescribed wrong that the patient might do. You can now apply negative reinforcement to correct that wrong thing that the patient is doing. Okay, so in behavior modification, when we talk about it in the table R there, we tried now to add in the train. Okay, the train which also symbolized other things. Okay, now let us look at social skills. Okay, social skills training. You can train the patient how to live with others within the community, and then you can also help the patient develop socialization techniques that can help them to work within groups. Okay, this is very, very important because to socialize it's healthy and the patient will not live in an isolated place. They are going to live with people within the community. So you have to teach them socialization skills. Okay, so away from socialization skills, we can now talk about a group therapy. Okay, so group therapy is different from mirror therapy, but it is also important that we talk about group therapy as a separate entity because it's a skill that is needed for nursing a patient with mental illness. So you can make sure that the patient is involved with others. This is to promote socialization, and you should put the patient in a group of people with the same experience so that they see that they are not alone within this problem that they might be facing. You should let the patient also interact with others as the impact of information sharing will help the patient to develop a coping mechanism or get coping ideas. You can encourage the patient. You can encourage the patient to share his or her ideas, the strength that they may have. This will also boost self-esteem. Okay, so patient self-esteem is quite important when you're talking about the mental illness. So you should also encourage the patient to undergo some kind of group cohesiveness. Okay, this is where a group is united to achieve a common goal. So you put some of these patients in a group so that they can perform a certain task and come up with a common goal. So that if they can achieve, then your group therapy is successful. And if your group therapy is successful, you can now within your discharge planning see how the patient has improved from the time the patient was admitted. So that takes us to another element, which is preparation for discharge. Family involvement in the care of the patient is very important, because if the family is not important, the patient will not have where to be discharged to. So that may lead to institutionalization, okay, which is also very, very important in mental health. Okay, family involvement also helps the family to understand the condition and how best they can care for the patient. Caring for patients with mental illness is quite stressful, as the condition is chronic. So you have to teach the relatives about the stigma that is there within the community. You have to teach the relatives about the signs and symptoms of the condition, so that they can have more knowledge and understanding about the condition. You can also teach the relatives on the drugs that the patient is taking and how the drug necessarily work, so that they can understand or differentiate the side effects from symptoms of a worsening condition. So it is important you teach them about the drugs, also so that they can give the drug at the right time, right dose, right patient, and the likes, as most nurses would like to put it, right time, right dose. Okay, so you should also involve the social workers to be seeing the patient home. This is to help the family to cope with the situation. Okay, it's very difficult, as I've indicated, to care for the patient with the mental illness. Okay, so preparation for discharge has been done. Here, within the same, you can ensure that you have some community health nurses that can be following up with the patient apart from social worker. So you can schedule visit, okay, within the community to visit these patients and see how they are recovering. You can also go with the patient and know where they stay, because it will also assess the environment that they are in, and you'll be able to pick out some triggering factors of their condition. Okay, how the patient is adapting and how the family is supportively helping the patient to recover. You may be discharging the patient, and each time they go home, within a short period of time, they come with the same condition. So it's when you visit the patient that is when you can understand necessarily the problems of triggering factors that are coming from the family. Family support is very important to help the patient recover. So within this lesson, we have tried to combine Chevo Ara, okay, Chevo Ara, which is the care of nursing for nursing patients with mental illness. So we have combined the Chevo Ara, but the Chevo Ara as a model. Okay, so Chevo Ara as a model may not necessarily include some of the things that we have talked about here, but you can necessarily make judgment that Chebuara and mental patients, they are almost the same. Okay, within these discussions, we have not necessarily looked at patients that may come with a mental health emergency. Okay, that if patient comes with a patient mental health emergency, it depends with the system that has been affected. In any emergency, airway, breathing, circulation, and emergency drugs is very, very important. So, when you're looking at Chevo Ara there, you can still add the emergency care, looking at the A, B, C, D for emergency drugs. So airway, if at all, let's say patients wanted to commit suicide and they tied something around the neck to take their life, so you have to pay attention to the airway. Okay, then breathing by observation, you have to see that the breathing is within the normal range. Circulation, for any bleeding that the patient may have, any loss of fluid that the patient may have, that may worsen the condition. So circulation is very important. When talking about drugs, okay, that is D in emergency situation, we can talk about restraining in mental health. Restraining, when you're talking about mental health emergencies, when you have a patient who is aggressive, patient who is violent, you can either use chemical restraint, okay, that is give drugs, or you can use physical restraint. So restraining is also one of those topics that we have covered, and it's an important component in the care of patients with the mental illness. Okay, so we have looked at all those things. If you listen to the other lesson on Chebo Ada and you listen to this lesson, that is fully, you should not have problems in caring for patients with the mental illness. Okay, so the emphasis of this lesson is on mental patient. MENTALPTS. This mnemonic should help you come up with a framework on the things that you can do for patients with the mental illness. We have modified this, not only restricting them to what we have put here as part of the mnemonic, but we have expanded it on this other part here on what these letters can necessarily help us in coming up with a framework for caring of the patient with mental illness. And what we have on this other side here are the elements that we have discussed, okay, that we have discussed in caring of the patient with the mental illness. So I urge you, after listening to this lesson, you can go deep with social skills that you can help the patient with mental illness. You can study through communication therapy that can be appropriate for different conditions that are psychiatry of nature. Okay, then in the admission process, what do you do for the patient? In the discharge process, what do you do for the patient? So all those things are very, very important because you don't want the patient to be institutionalized. So mental patient is the easy way that can help us know or draw up a framework of things that we can do for patient who is having a psychiatric illness. So from me, I'm saying thank you very much and keep studying.